Okay, so that was the cells. The whole point of this cascade is to show you that on the first exposure to an antigen, and again, an antigen is the protein located on a pathogen that identifies it as other. On the first response, our response is not going to be that powerful, but hopefully we destroy it anyway. On our second response, we'll have a much, much higher immunological response to that thing. So this is specifically measuring antibodies. The antibodies you can produce in round 1 exposed to a specific antigen are very, very low, and the antibodies you produce the second time is very, very high. And this means that you're going to be much more capable of destroying something specific the second time that you see it. And then if you see a new pathogen, it's going to start all over again. That's all that this is representing. You see a second pathogen, you're going to start all over again from scratch for that system. So really what we're clarifying here is innate versus specific immunity. All of these cells back here, this whole pathway, this was all about innate immunity. These only come into play after you've been exposed to a specific antigen. Again, so natural killer cells, I did this as a cleanup topic before stopping for break. Natural killer cells act in innate immunity. They are non-specific. They're going to destroy anything that has a foreign antigen. Anything at all, and that does include cancerous cells, because cancerous cells have mutated DNA, and that means that their antigen is also going to be slightly mutated. It will be recognized as other. This is a nice table with some summary. I think it also has, let's see, no, it only has the ones that we went over. That's fine. Lymphopoiesis is a similar concept to hemopoiesis in the sense that we're talking about how blood cells are formed. In this case, we're talking specifically about white blood cells. Just like red blood cells, white blood cells are created exclusively in the bone marrow. So they come from hemopoietic stem cells. The stem cells are only in red bone marrow, and those differentiate into our lymphatic cells that we're talking about today. Now there's going to be a little bit of a difference between creation of cells and maturation of cells. Some of these specific lymphocytes will have maturation sites elsewhere. So for example, lymphatic cells, T lymphocytes, are going to differentiate and develop in the thymus gland. So that's actually a very, very important differentiation between those two concepts. Over here we're talking about the creation of new cells. Here we're talking about the maturation of cells. All of these cells are created, synthesized, developed in the red bone marrow. They will have different sites of either maturation or in some cases mitosis in other glandular tissues. Some of them will experience this in the spleen, some in lymph nodes. For T lymphocytes, it's the thymus gland. Yes?
And they get there through the lymph system.
They're going to migrate through the hematologically through the blood and through the lymphatic system. Absolutely. So if we go back and we watch that Inner Life of a Cell video, it actually starts in the bloodstream. You can actually see white blood cells in the bloodstream as well. And you know that from your hematocrit too. You do have about 1% of that hematocrit is buffy coat, which is white blood cells. So they will travel in the bloodstream, they will travel through tissues, they can migrate through tissues as well, and they'll travel through the lymphatic system. What this means is that in order to be immunocompetent, in order to have a working immune system, you're going to need both bone marrow and your maturation site. So for certain cells, you're going to need a thymus gland. For other cells, you're going to need a spleen. For other cells, you're going to need lymph nodes. And that's going to have relevance when we get to patho, because there are going to be medical conditions where you don't have working red bone marrow for some reason, where you don't have a working thymus, where you don't have a working spleen, or where we've removed lymph nodes, for example. So those are all possibilities. And lacking any one of those maturation sites is going to make a person immunocompetent or less immunocompetent. Does that make sense? So all lymphocytes originate in the red bone marrow, but their maturation sites differ. So lymphatic nodules. There's a variety of locations where you will find lymphatic nodules. This is not the exact same concept of lymph nodes. Lymph nodes are a specific kind of lymphatic nodules. When we say lymphatic nodule, we just mean that there's going to be a place where a lot of white blood cells will be found. This histology image is showing you MALT, mucosa-associated lymphatic tissue. And that means that in a lot of mucosal surfaces, who can think of a mucosa? What's a mucosa? Where are some of your mucous membranes that are maybe more exposed to the environment? Respiratory mucosa, absolutely. Stomach, so gastrointestinal, absolutely is a big one. Also, genital and urinary tracts will have MALT. So this is going to be embedded within the walls of those mucosa. Just places where you're going to be a little bit more vulnerable to pathogens, things that are more exposed to the environment, will have MALT in general. We'll also have a specific term for MALT in a portion of the small intestine known as the ileum. When they're there, we call them Peyer's patches. So this is a Peyer's patch, I believe, right here. All it means is that if you happen to have a pathogen and try to invade through that mucosal surface, there's a high probability it will encounter this lymphatic nodule, and those white blood cells can start that cascade of recognizing the antigen and developing antibodies to that antigen and then fighting that antigen, hopefully successfully. Tonsils are a type of lymphatic nodule. Histologically, this is an entire tonsil that has been removed. And notice this pattern here. So if you go back to this, you'll see a sort of darker outer ring and a sort of paler inner ring, because you have a germinal center where things are proliferating. Cells are undergoing mitosis in the middle and hanging out on the outside. So we call that the germinal center. You'll notice that this is, by comparison, very zoomed out. You have these sort of concentric rings. You have a paler patch and then a darker patch. You have a paler patch and a darker patch. That means every single one of those is a lymphatic nodule unto itself. So you've got this big cluster of lymphatic nodules, and then you have a connective tissue sheath around most of it, and that is a tonsil. So again, germinal centers will be a little bit paler, and then you have the darker outer ring. Lymphatic nodule within a tonsil. You do have 3 sets of tonsils. You have pharyngeal tonsils, and those are located in the nasopharynx. So this is a structure that we're going to see with both respiratory and digestive systems. The pharynx is the throat. So you're going to see in the next couple of weeks the nasopharynx is going to be posterior to the nasal cavity. The oropharynx is going to be posterior to the oral cavity. And the laryngopharynx is the throat posterior just to the larynx. So the whole thing, this funnel-shaped throat, is your pharynx. So your pharyngeal tonsils are in the nasopharynx. If you open your mouth and say, ah, you will not be able to see this. It is posterior to the nasal cavity. Yeah.
When your tonsils are taken out, do they take out all 3 or only specific?
They generally, as I understand it, only take out specific tonsils.
And do you know which ones are at random for each person?
Generally, it's going to be the palatine tonsils.
Okay.
So when we open our mouths and say ah, down there at the soft palate, just in the oral cavity, those are going to be palatine tonsils. They're of the palate. You can see your palate. You can touch your palate with your tongue. I recommend doing it now just to have a physical memory based on this. That's your palatine tonsil. And then if you happen to have a tongue depressor, you may be able to pull the tongue forward far enough to see the lingual tonsil. It's going to be situated posterior to the tongue and just anterior to the epiglottis. Yeah, so some people will have the lingual tonsils removed as well. As I understand it, it's less common than the palatine tonsil.
I did those and my allergies.
You did both? Yeah, I'm not surprised. The linguals are just as capable of getting infected. Yes?
What's the height of tonsils?
The point of the tonsils is that they're lymphatic nodules, so ingested or inhaled particles are likely to encounter white blood cells that can start our immunological cascade. That's a really good question. Question?
Yeah, so before you said if any of these were taken, oh wait, that's not maturation site.
Yeah, so tonsils are not necessarily one of our absolutely necessary maturation sites.
Okay.
Are there any differences between somebody who has been removed and somebody that has them? Is it the same?
There's this slight difference in the immunology of somebody who's had their tonsils removed versus not. If they're getting frequently infected, then it's healthier to have them gone by comparison.
And
I
what
was
causes
really sick until I got mine taken out, and
I
then I
got
wasn't
mine
sick
too.
at all.
Yeah, but I don't know which one. I don't know.
One thing to note is this vacuum right here. This is not artifact. You have these things called tonsil crypts. And if you've had your tonsils infected before, this is going to get super gross, just warning you guys. It's about to get disgusting. Tonsil crypts, if you have multiple infections of your tonsils, these get bigger. And so you can get food that gets caught in these, and it can sort of granulize, and you get these things called tonsil stones or tonsilliths. And they smell really, 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 really bad. Like, so if you're ever like hanging out with a person and you're 5 feet away from them and you can already smell that their breath is terrible, they probably have tonsil stones. And they're generally considered harmless, aside from the fact that they smell bad. And if you are one of those people who likes gross out videos on YouTube, you can look up on YouTube people prodding their tonsil stones out. It's pretty disgusting. So have fun with that. Yeah. They're hard to get out. They're not pleasant. You had a question, Chris? Did I answer it?
Yeah.
With tonsil stones?
Yes.
Mm-hmm.
Can they swell and like block?
Yeah. They can block that oral opening eventually. They can get quite swollen. Okay, lymphatic organs. Your thymus, we've already mentioned, is where our T cells are going to mature, maturation site for T cells. And we're also going to talk a little bit about the anatomy of lymph nodes. And then finally, what does the spleen do? Which is my favorite. All right, thymus gland. Thymus gland is fun. For one thing, it's springtime right now. This is spring 2018 as this is being recorded. Histologically, the thymus gland has these things called thymic corpuscles, and they look like little roses. And isn't that lovely? Happy spring, everybody. Enjoy your thymic corpuscle. I don't really have any significance for you for what a thymic corpuscle is. It just looks like a rose. Histologists love it. They're like, look, I get you a bunch of thymic corpuscles. Aw. And it's fun. Aside from that, the thymus, I call it the dojo. So we talked about that cascade of all of our immune cells coming to find that pathogen, find that pathogenic organism and destroy it, right? In order to develop that skill, those cytotoxic T lymphocytes have to go learn how to recognize and respond to that specific antigen. So that's part of why it's specific immunity. The thymus is going to be the site of that maturation. So I call it the dojo. This is where cells go to become immunocompetent. This is where the cytotoxic T cells learn to be deadly killers, which I think is cool. It also means that if you are lacking a thymus, you are lacking the dojo, and any new pathogens that you are exposed to will be able to bypass the system. You won't be able to learn to kill the newest and greatest threat to your body, right? So when you're very young, you'll see on this chart here that your thymus initially increases in size prenatally and then is very, very active and large in your childhood. And then as you age, it starts to become smaller and smaller. And in fact, in terms of actual tissue of the thymus, actual dojo, it degrades considerably after age 20. By the time, here's where I am, and my thymus is already pretty small. By the time you're 60 or 70 or 80, at that point, we already consider you immunocompromised. You don't have a dojo. The newest weapons that are coming out in the biological arsenal are not something you're going to be able to adapt to anymore. You can still find one, but it's going to be mostly fat at that point. Yes?
Is this what we spoke about, like
like relating to dreams, how some people say that like adult or like elderly folks don't even have a thymus anymore. Does anyone remember?
Are you talking about the pineal gland and how that degrades in size? The pineal gland
that shrinks
does
too?
it shrinks as well,
Okay.
and that is possibly why the elderly have a harder time sleeping.
Okay.
Yeah,
Sorry.
different concept, but same
remember
fallout,
chart.
right? Or same issue where it gets smaller and smaller with age, and that is going to cause problems for the elderly. Yes.
So this is why like pneumonia shots are for like 65 and older.
Right. So when we have people who are elderly and they don't have much of a thymus gland, vaccination becomes even more important because their own systems are going to be less capable of developing new antibodies. It's still going to be operating on the idea of a vaccine, which is to introduce the antigen so that we develop specific immunity for it. It's just to ensure that that elderly process and body has adequate time to work with whatever it does have. Absolutely. Okay, again, here's another thymic corpuscle. If you didn't believe that they looked like roses before, they really do. Site of T lymphocyte differentiation and maturation, immature and mature T lymphocytes. And again, in adulthood, T lymphocytes can only be produced by cell division, not by maturation of new cells in the thymus. Are we ready to continue on? Lymph nodes. We've mostly got some anatomy for lymph nodes. Lymph nodes are going to be found along the pathways of lymphatic vessels as that lymphatic fluid is returned to the cardiovascular system. These will be visible in gross anatomical dissection. This is the visible portion of the lymphatic system. And you're going to have clusters of them in a variety of places, such as axillary lymph nodes. Hopefully by now you know your regional anatomy. That's going to be your armpit. Inguinal is going to be sort of that iliac region, inguinal iliac. Cervical lymph nodes draining your head and neck. A little bit of anatomy of lymph nodes. I mentioned earlier you're going to have efferent vessels and you're going to have, afferents and efferents. The general structure of the lymph node is such that you will have multiple afferents, multiple arriving lymphatic vessels that will be washed through these lymphatic nodules. Each of these is a lymphatic nodule. And all that fluid will be sort of filtered towards the center here, and it will be drained into one single efferent vessel. So it's going to be a site of convergence for that lymphatic fluid. So there's a lot of anatomy on this chart. This is on your lab practical images as well. It's an encapsulated structure. There are invaginations of capsule called trabeculae that are going to help create lobes of the lymph node. So notice how it's kind of segregated, how it's kind of lobulated. Yes?
So on the lab practical list, trabeculae is not on there, but will it be probably on the exam?
Only if it's on the list,
Okay, so if it's not, it will not be on the exam at all?
as I understand it. That's generally how it tried to organize that. Now, as for these individual lymphatic nodules, you have the whole nodule within the cortex. And again, cortex is always going to be the outer portion. It's the bark of the tree. And each of these nodes is going to have that pale germinal center and a region around it, right? So there's the whole lymphatic nodule, and then there's a pale germinal center to it. You're also going to have a medulla, which has medullary cords, some connective tissue, and sinuses, some spaces. You're going to see the word hilum a little bit for this unit in a few different cases. The word hilum in general is going to be where tubes come and go, if you want to think of it big picture. You're going to have a hilum of your lungs, where your pulmonary artery and vein, as well as your bronchi are. You're going to have a hilum of your kidneys, where your renal arteries and veins are found. You're going to have, let's see, a hilum. Your liver is going to have a hilum, where you're going to have arteries and veins, and also the ducts for your gallbladder. So where things come and go, that's a hilum. Yes?
So is each afferent, whatever,
Mhm.
is that in a hilum?
No, so these are not considered hilums, hyla.
Okay, so only the,
Only the efferent is going to be located at the hilum in this case. So it's one-way flow, again, because of valves. This is your only picture, I believe, for actual lymphocytes. I don't think there's anything that would be fair for me to point at and say, that's this kind of lymphocyte or that kind of lymphocyte. I don't think that's doable. That's why we have our practical questions about these cells list. Okay, I think that's the major anatomy. Capsule, trabeculae, cortex and medulla, cortical sinuses, medullary cords, medullary sinuses, and the hilum. I think we're good there. Here's what one looks like in gross anatomical dissection. This is an extraordinary dissection. It is not normal to be able to see actual lymphatic vessels coming from this thing. I almost wonder if they injected it with something artificial to be able to see them, because I've never seen that. Finally, what does the spleen do? The spleen does some very important things. The spleen is going to be a maturation site for some B lymphocytes. In fact, I don't think that's really on here. No, it is. It's going to contain T and B lymphocytes and macrophages. It's going to be a reservoir for red blood cells. So there's actually this really cool thing. If you start losing blood, if you have a stab wound, your spleen will actually squeeze itself and squeeze some of its stored red blood cells out into your body to help replenish that supply of blood that you lost. Just like, that's insane, right? That's really cool. Okay. Phagocytizes old defective red blood cells and platelets. This is what we mean when we say the spleen filters the blood. What it's really doing is it's taking old, elderly, decayed red blood cells and taking them into the spleen tissue itself, out of the bloodstream, phagocytizing that red blood cell and recycling any proteins it can. So the reason I'm specifying this is that the spleen filters the blood. The kidneys filter the blood, the liver filters the blood. So we have to be specific about what we say what we mean by the words, it filters the blood. Does that make sense for everybody? Overall, yeah, it filters the blood. Specifically, it gets rid of defective old red blood cells. Do you guys remember the life cycle of the red blood cell? How long did it survive? 120 days, yeah. Question?
Is there anything else in the body that does the same thing, or only the spleen does that?
The liver can also do this. The liver is going to act a little bit like a second spleen in addition to having about 20 other roles.
So if you do not have a spleen, would your liver overwork then, and would it be concerned of having that bad liver when you get older?
There are concerns associated with getting rid of the spleen. It's called being asplenic. If you either have a non-operating spleen or you've had your spleen removed, you're asplenic. You're considered immune compromised, and I do believe that would put some extra stresses on the liver. I'm not sure what that would look like long term in terms of health. And because there are white blood cells, again, phagocytosis of bacteria and other foreign materials while it's filtering the blood, why not? The position of the spleen, it's nestled up under the respiratory diaphragm, somewhat protected by the rib cage, especially during passive exhalation. And you have a splenic artery and a splenic vein, and this one has a hilum as well, where that artery and vein enter that organ. It is another encapsulated organ. It also has trabeculae. Here's a wonderful dissection of the abdominal cavity. Here's the spleen. It's actually relatively large. My spleen's probably this big, or they're surprisingly big. This is the pancreas. The pancreas is never that exciting. It looks like chewed up hamburger meat. Pancreas, spleen over here. Okay, what else do we have? White pulp and red pulp. White pulp is about white blood cells, and red pulp is going to be where that actual filtering, that's the venous supply, that's going to be where we're going to really have that, the destruction of the red blood cells. When we need for blood cells to get it in and out easily, what type of blood cell or capillary are we going to have? Remember, there's 3 options for capillary beds. Sinusoidal. So what does sinusoidal mean?
There's lots of things.
Lots of big holes. So lots of big holes in sinusoidal capillary beds means that entire blood cells can come and go in the spleen as they choose. That's why the spleen can just squeeze itself and release red blood cells into the cardiovascular system. So that's another reason we learned those 3 types of capillary beds. Okay, that's about it for this. I'm about to show you a YouTube video made by Harvard Medical School. It's What Does the Spleen Do?